Giardia is one of the most common waterborne causes of intestinal disease. It knows no borders and encounters few restrictions in the environment. Any body of water, creeks, streams, rivers, and lakes, can be a perfect harbor for the Giardia parasite. Rain falls on many places around the country, and snow covers other areas. But when the skies clear and the snow melts, the puddles and pools of water left standing become safe havens for Giardia, which infects the small intestine of many species, including humans, dogs, and cats. Veterinarians and pet owners should be aware of the seriousness of Giardia infections. They can cause significant gastrointestinal disease, including anorexia, lethargy, vomiting, diarrhea, and weight loss. Even though it's common for pets to present subtle symptoms of Giardia, they can still remain carriers if left untreated. Giardia also poses a serious zoonotic threat. Researchers believe that animal-to-human transmission is much more likely than previously thought. Ingestion of cysts is capable of initiating infection in humans.
One of the things that we have found important in treatment is that the animal's environment needs to be cleaned up by physically removing any fecal material that's present, but also to make sure that the animal's hair coat is carefully shampooed to remove any matted material that can harbor the cysts and can foster reinfection of the same animal.
A study on the prevalence of Giardia, conducted and sponsored by Fort Dodge Animal Health, contradicted conventional wisdom. Many people involved in animal health care had assumed that Giardia occurred primarily in rural and mountain settings and coastal areas like Seattle, Portland, or San Diego. What the actual survey results showed, however, is that the Giardia parasite is more widespread than previously thought, occurring in just about every part of the country. The study further shattered the stereotypes about Giardia prevalence and location. The highest rates of infection were found in the suburbs of two urban areas that could not be more different in terms of geography, topography, and climate. In practical terms, if your clinic sees an average of 50 dogs a day, then up to 6 of those dogs are likely to be infected with Giardia.
The Fort Dodge study was quite unique in that it used a very large number of animals and animals that were presented to veterinary clinics. So the information really added dramatically to what we know about Giardia. What I found very interesting was not only the prevalence rate of about 7%, but the fact that about 2/3 of the animals that were positive for Giardia did not have any clinical signs whatsoever, and that infection was not known about by the owner or the veterinarian unless it was specifically looked for.
Despite its prevalence, Giardia continues to be one of the most misunderstood and underdiagnosed of all infectious diseases.
Most people would agree that the most common clinical sign we see both in dogs and cats is acute diarrhea. And there's a wide spectrum of the severity of this diarrhea, where animals can just have mild clinical signs that are essentially an inconvenience for them and for their owners, all the way progressing to life-threatening diarrhea that requires hospitalization, intravenous fluid therapy in order to support the animal while Giardia is treated. We also, at least on a referral practice, say here at Virginia Tech, we see a large number of animals that have chronic diarrhea that are infected with Giardia. And then less common than that, we see some animals that have either acute vomiting or in some instances chronic vomiting from the infection. Now, the animals that have severe clinical signs will have decreased appetite, they can become weak and lethargic, and they can also become dehydrated and have changes secondary to the severity of their diarrhea.
Common and popular test methods do not always expose this hidden disease. Direct smear tests are prone to false negative results. Traditional flotation test methods are inadequate. And retesting increases cost, client frustration, and patient discomfort.
Traditionally, Giardia has been somewhat difficult for veterinarians to diagnose in practice. First of all, the use of zinc sulfate flotation techniques has really been shown to be very useful and very practical for veterinarians, as long as the person reading the test clearly knows what Giardia cysts look like. This test has several advantages of being readily available, inexpensive, relatively quick to perform, and it will identify not only Giardia, but will identify the eggs of most of the routine parasites that we see in dogs and cats. What's extremely important is the test has to be done with zinc sulfate solution, and it has to be centrifuged for at least 5 minutes if we're going to identify the parasites that are present. Recently, an ELISA test has been marketed for in-office use as SNAP ELISA test. That preliminary data shows that sensitivity and specificity appears to be quite good.
It's a fact that the newer ELISA tests have shown that Giardia is much more widespread than previously thought. Giardia is not exclusive to any particular part of the country and can be found in almost any body of water. Veterinarians should also know that common treatments for Giardia have limitations. Drug treatments do not always cure infections and do not prevent future disease. They can also cause side effects. It should be noted that there are no approved drugs for Giardia for use with dogs or cats.
There are two commonly used treatments for giardiasis in dogs and cats. The newer treatment is fenbendazole, which has recently been shown to be very effective in treating animals that have been either experimentally infected or experimental animals that have had natural infection. The drug is very safe and has the added benefit of being effective against other GI parasites such as roundworms, hookworms, or whipworms. The other drug which we have used for a longer period of time is the antibiotic metronidazole. Metronidazole has been shown to be effective in about 2/3 of dogs with naturally acquired infections, and some information in cats suggesting that it may be up to 100% infected in groups of cats that have received experimental infections. The disadvantages of metronidazole is that it has a bitter taste, and some animals may be hesitant to accept the 5-day treatment required. In addition, a small percentage of animals will develop sometimes very severe neurologic complications which can progress to seizures and coma. So for this reason, a lot of people are using fenbendazole because it does have a safer drug profile.
In treating Giardia, a little common sense goes a long way. Good housekeeping routines, as well as providing good hygiene, grooming, and overall care, helps prevent the spread and recurrence of Giardia.
The zoonotic aspects of Giardia have been somewhat controversial in the past, but modern molecular techniques have clearly demonstrated that strains of Giardia that infect dogs and cats are indeed zoonotic. And so the potential for animal-to-person transmission certainly exists. From a public health standpoint, the highest risk for a human becoming infected with Giardia is due to waterborne outbreak. But what we really don't know is how do pets contribute to the Giardia load in waterborne outbreaks.
Because common treatments using drugs don't always make patients better, vaccination is the practical, safe, and efficacious way to prevent Giardia in the first place.
The Giardia vaccine for dogs and cats has been shown to be safe and efficacious in reducing the incidence of infection, reducing the number of animals that will shed cysts, and very importantly, reducing the number of cysts that an infected animal may shed.
Fort Dodge's GiardiaVax is the first vaccine available as an aid in the prevention of the disease and cyst shedding caused by Giardia infections in dogs. GiardiaVax keeps healthy dogs healthy, with a 1-year duration of immunity that has been confirmed by challenge. It also reduces complex and burdensome treatment protocols. GiardiaVax can be given to healthy dogs 8 weeks or older.